Hi, I'm Elisa Demena and I'm back with the cavities of the body. So let's take a look inside. Basically on the inside of the body, it's not just a bunch of skin, a couple of bones and skeletons, and then some organs. Everything's sequestered, protected, separated by a series of body cavities and membranes, specific membranes known as the serosa. We're going to take a look at those in this lecture. So the first part is I want you to keep in mind that organs tend to move or get jostled or get moved or get jostled. And if one organ system is being disrupted by an adjacent organ system, it can cause damage, tearing, abrasion, and that's no good. So that's one of the reasons why the body cavities and the serosa that separate them are so important to maintaining overall health. And there's two sets of key cavities, the ones up front and the ones in back. The ones up front are going to be the ones that are ventral, right, where your viscera is, ventrovisceral, and then dorsal on the back, right, just like a shark has a fin on the back, right. Let's look at some of the primary cavities that we talked about. They're actually subdivided out, but generally here's how they work. The dorsal ones are going to be everything that is dealing with the central nervous system type stuff because it runs down the back. Dorsal, right? It's generally considered to be in the back. Ventral, that's everything that's going to be up front. Organs, pelvic cavity, abdominal cavity, the pleura, right? Pleural, meaning there's two, one for each lung. The mediastinum, which is just above the cardial, or actually, sorry, the pericardial cavity as well. So the thoracic cavity, let me get a change in marker. Here we go. So thoracic cavity, think of it being, remember when we talked earlier about the part of your body up in the chest region, which is the thorax. That's analogous to all those places in bugs, the thorax of a honeybee, right? Same genes in them, same genes in you, or family members that create the structures in that particular part of the body. Okay, and then the abdomen, or the abdominal cavity, that's containing the things that you would normally also find in an abdomen, digestive stuff primarily, the intestinal tract, whatnot. Pelvic cavity sequesters out reproductive organs and the bladder itself. Up top, going back to and changing the color, right, of the thoracic cavity, we're going to look at the pleural cavities. So think of it, it's the only one that is duplicated, two of them, one for each lung. Pericardial cavity is within the mediastinum, and which is divided into two parts. So pericardial, so cardial, think of cardio, right? So that's where the heart is. Peri, sort of on top of, it's not, but it's in the same position, pericardial, right? And the superior mediastinum is just the portion of that central component of the thoracic cavity, is just above where the heart is. The dorsal body cavity protects primarily components of the nervous system, right? Central nervous system. So the cranial cavity encases the brain itself, and the vertebral cavity encases and protects the spinal cord. Ventral cavity, it's got a lot more to do. All the internal organs are, well, primarily conventional canonical organ systems are collected there. So this is the viscera, right? The divisions that we talked about already are the thoracic cavity and the abdominopelvic cavity. So again, pleural cavities, there's two, and each one of these is going to surround the lung. So instead of it being something named directly for the lung, pleural, think it's just, more than one, the exact same type of cavity. The mediastinum actually is the top part of the central component of the thoracic cavity. And although it contains the pericardial cavity, the superior mediastinum is dealing with things like the esophagus and the trachea, just like the lower components thereof. And the pericardial cavity just encloses, encircles, encapsulates, protects, and sequesters the heart. Abdominopelvic cavity, just as we were talking about, has two components, right? So abdominal component and then the pelvic component. So abdominal contains primarily intestines. There's a lot of intestines in there. Also holds in other components of the digestive tract, such as the liver, also the spleen. It contains the stomach proper. Okay. Oh, that's right. And the pelvic cavity, urinary bladder, reproductive organs, as well as the rectum. Each one of these cavities is surrounded and actually formed by a set of membranes. We call these membranes the serosa or the serosae, the serous membrane, right? And they're really thick. And so how you want to think about them as being, so they're double layered, and they form kind of like this. Like think of a big bubble, and then think of a fist being pushed into the bubble, and you'd note that there would be two linings, like an interior lining and like an exterior lining, and then on the inside, your fist would be where the organ would lay, right? So it would be like where the heart is, it has two double thin, or double membranes, okay? The parietal and the visceral, those are just the different sides of the membrane. Those are just which layer is it, okay? So whenever we think of parietal, it's right next to, so it's right next to the body cavity walls, right? So it's like right next to the outside, so right next to all the other serosa. The visceral serosa is next to the viscera, or the organ, right? So that's the layer that's next to the heart, for example, in the pericardial cavity. So visceral next to the organ, and parietal, it's on the outside. It's kind of next to the other parts of the serosa. Each one of these layers, I'm sorry, there's only two. These two layers are separated by a thin layer and some kinds of thicker layer of viscous fluid. And we call this fluid the serous fluid. It's kind of, if you were to touch it, it would feel very, very sticky, right? Really, really heavy and almost jelly-like in most parts. And that kind of prevents the friction from occurring as those two particular membranes rub, move, or adjust against each other inside of the cavities of the body. Also, where does it come from? Why wouldn't you know? They're secreted by the layers of the membrane themselves. Ventral cavity. So pericardium we've been talking a lot about. We already know that that surrounds the heart. The pleura, right? Pleurae, two of them, two lungs surrounding the lungs, and the peritoneum, abdominal pelvic cavity. There's a lot of distensions within some of the inferior regions of the abdominal pelvic cavity. Specifically, we're referring to disruptions or loss of integrity in the peritoneum. So you just might see that quite a bit with some of your patients, especially anyone who's gone through childbirth, gained and lost a lot of weight. Abdominal pelvic region, as we know, is huge. It's super huge. And so what we've done is we've divided it into quadrants. Quad means four. So 1, 2, 3, 4. So you can think of that as like, I guess, a 4-pack, if you will. So this is what we use for the abdominal pelvic quadrants, right? Quad meaning 4. So upper right quadrant, left upper quadrant, right lower quadrant, and then this is also the left lower quadrant. Sorry, my bobblehead's right in front of it. Basically, although we do have some organs, such as shown here, here's like the stomach, and obviously huge components or parts of the intestinal system are going to traverse each one of these quadrants. It helps us localize specific things such as pain or injury. So the quadrant region, or the abdominal pelvic quadrants, are a very nice quick reference. When we're getting a little more specific, we start looking at the abdominal pelvic regions that have 9. So this is not a quadrant. A quadrant has 4. A region, for this example, we actually further subdivide into 9. It's very specific, and it has some names that hopefully, when I tell you a little bit about what they mean, might help you just remember what they are. Things that are important, I would, for exams and for homeworks, I would know images such as this that have the divisions of the abdominal pelvic region. I would know what organs are where. If I ask you where the liver is, are you going to tell me it's in the hypogastric or pubic region, or will you be telling me it's primarily located between the hypochondriac region on the right side as well as the epigastric region? One of those is right, one of those is wrong. Okay, so let's talk about naming. Oh, I'm losing my mic. Okay, here we go. So epigastric region right here, epi, think like epidemic, right? Like it's just above, it's just outside. So epi is just above the gastric region. It's primarily like the hot zone for where you would find things like your stomach and, the bulk of the stomach, where folks will start talking about those kind of issues. Gastric, anytime you see gastric, that's literally referring to the stomach. So that should be helpful there. So when we talk about the hypochondriac regions, we're not talking about like a hypochondriac, right? Somebody who says, oh, I'm sick with everything, but they're really not. These are talking more about, let me see if I can change color, chondro, actually. Chondro, which we'll learn about a little bit later, is a scientific term for cartilage, right? It's a type of tissue, structural tissue related to bone. It means that it's talking about the hypochondriac regions. So when we think of things like hypochondriac, I want you to think chondro like cartilage, right? Chondroichthyes, for example, is the scientific terminology for a shark. A shark with no bones, but only cartilage. I don't know. Somehow that helped me. But let's keep moving on. Let's look at the umbilical region. Umbilical region is the part of these 9 regions where you would find the belly button, which forms because that's where the umbilical cord was, right? So that's pretty centered in thinking and centered in the abdominopelvic regions. Also, on either side of the umbilical region is the lumbar region. So we looked earlier at the lumbar region of the back, right? Where the lumbar vertebrae are. I think, oh, my lumbar is, oh, my lower back, right? That's lumbar. So the transition between where we're looking at someone's back to where we're looking at someone's pelvic girdle happens at this point right here, this whole lower row, right? That whole lower row is primarily in the hip girdle, the pelvic girdle, right? So when we talk about the naming structures, it's going to be helpful to think of that particular overall morphology. So iliac, let me see if I can change colors. What haven't we used? I guess yellow? Let's go with yellow. Okay, so iliac, right, refers to the iliac crest, which is that top blade of the hip bones. Like you can feel it right at your, if you put your hands on your hips, that's that pokey part that sticks out right underneath your waist. That's the ilium. So that's the iliac region. There's a left and there's a right. Also is the hypogastric region. So it's just below or under the gastric region, right? Epigastric, hypogastric region. So hopefully that helps out a little, at least in understanding where things are and who's there. Smaller body cavities, those we just went over the heavy hitters. Those are the large, giant Serosa, I guess is what you would think of it. But we have a bunch of other little ones. Some of these cavities are sequestered and internal only, but many other cavities are open to the outside world. Some of these include things like the oral and the digestive cavity, right? It's essentially exposed to the external environment all the time. Also, the nasal cavity is another one. The orbital cavities are less. So orbital, remember again, nasal nose, orbital eyes. So those are cavities where we house the eyes. And then the middle ear cavity. So the inner part of the otic region is at least where the middle ear is. And we'll look a little bit lastly at the overall architecture of the ear a little bit later on in the semester. But please, if we don't get to it through all of our lectures, I already have materials up there. So, you know, I love the senses, so go for it. Okay, and then finally we'll have an enclosed type cavity. So joint cavities such as a synovial cavity, which we'll talk about a little bit after we discuss things like the skeleton in this class, are close to the outside world. They're housed internally inside all the time. So these guys over here, these are the ones we're worried about: outside invaders, bacteria, fungus, infections. Joint cavities less so because they have less of an opening to the outside world. All right, so at this point, we've finished most of the material for the first chapter and the introduction. And I'd like you to check on Blackboard. Just make sure you get through all your chapter readings before you take your quiz. In some classes, you have an assignment instead. It's like the same thing. It's your, end of chapter thing you do. So, right, and email me if you have any questions at all. I would love to be able to help you guys out, and always I'll point you in the right direction. So, great. We'll see you next time.